My name is Brooklyn Wigington, and I did my project, over the effect of health literacy in polypharmacy in the elderly. And so I chose this topic because polypharmacy is really growing in how common it is over the last few decades, and it's only going to continue growing in importance. As you can see in this graph, 51% of older adults, which is defined by 65 years or older, are on 5 or more medications, which is the definition of polypharmacy. And then 12% of older adults are on 10 or more medications. And so, as you can see, this is pretty significant. And the issue with polypharmacy is the more medications you take, the more likely they are to interact with each other. This is compounded by the issue that comes with age. By 80 years old, you have, reduced liver function, you have reduced renal function, and this is an issue because, as we know, drugs are metabolized and excreted within the liver and their kidneys. So this really kind of compounds how dangerous that is for our elderly patients. One of the reasons that polypharmacy is so common, it's actually the most common cause of polypharmacy, is this thing called the prescription cascade. It's basically when a patient is put on a medication that causes a side effect that they don't like, and then so the doctor or provider puts them on a new medication to treat that side effect. So it the cycle goes on and on until basically you have this poor guy here falling into a pile of pills. And most people, a lot of the patients I've seen, will be on 10 to 20 medications. They don't know what most of them do. They don't know why they're on most of them. And so there's a lot of current solutions in place to try to help keep this from being so dangerous. Most of them focus on catching those drug-drug interactions or contraindications, like maybe they're on liver renal, liver failure, things like that will make those drugs contraindicated. Things like screening tools within EHR, medication reviews by pharmacists, but these just aren't adequate because they require healthcare providers to be with that patient, or they require that patient to be within hospital walls. And so in an ideal world, the patient would have access to something that is really low cost, if not free, and that they have with them all the time. And so what I propose is to treat that knowledge deficit that a lot of patients have, especially our elderly patients, that knowledge deficit regarding their medications and how certain things might interact with it, those medications they're on, and what over-the-counters they should avoid with this medication they're on, things like that. Treat those, or to explain those things to them more in depth. And I think a lot of people underestimate the capability of older adults in learning new things, especially when it comes to complicated things like their medications. But I think that they're a lot more capable of learning, especially if they're willing, than we probably give them credit for. So to be able to test this theory, I'm going to put together a health education presentation, and I'm going to present it to about 30 to 60 older adults in an assisted living center, and I'm going to measure their confidence levels regarding their medication, educate how much knowledge they have about their medications before and after the presentation. And hopefully this experiment, if you will show that increasing their health literacy will increase their confidence, and therefore it will give them the ability to identify and prevent future adverse health effects resulting from polypharmacy from ever even happening. And they'll be able to do it for free, and that knowledge will be something that they can keep with them at all times, and they don't even have to rely on the healthcare system at all for it. Thanks.